Hi, welcome to Facebook Live. I'm Annette Mercatante, the Medical Health Officer at St. Clair County Health Department, and we have with us today our special guest, Trish May from Tri-Hospital EMS. Trish, you say a few words about yourself and your background?
I work at Tri-Hospital EMS, like Dr. Merck said. I have been there since 1996, and my primary role there is as the operations manager. However, I still go out and run calls on the ambulance and just do a little bit of everything.
So Trish has feet on the ground, eyes on the situation, so firsthand experience. So if you have questions about what this looks like, what kind of experiences she's had, and what the agency's experience has had taking care of COVID patients, this is a great opportunity to ask. So as usual, we're going to start out with a real quick data review, then we're going to take your questions and be on the air for about a half an hour. So feel free to send your questions in. So our data today is behind me. We have 32 new cases in the last 7 days, which has brought up our average new cases per day to 4.6. As you remember, a couple weeks ago, we were below 1. Then we got into the 2s. So we are seeing some changes with that, but I would still consider this a low rate, and this still puts us at a moderate risk, not a high risk. And then below the age and demographics, there is definitely a shift to younger age groups currently with our positive cases. The next slide shows again the average daily new cases and the trends that we see. Our first big peak, our reduction over the next several weeks, and there we are at the end with a gradual upward slope that has not plateaued yet. And our goal, of course, is to see that thing plateau, flatten out before we start getting into the upper ranges. You'll also know those blue bars are the nursing home cases in excess of all of ours, and you can see that there are not a lot of blue bars right now. Our nursing homes are doing pretty well. Next slide. And then our average daily positive cases, so our testing capacity remains okay, not great. We are testing about 140, was it, per day on the average, which is up a little bit, but our percent positives remain low at under 3%, it's 2.6%. So we are doing pretty good with testing, and we're not seeing a big jump in positive tests. But we are testing a lot of people now who aren't necessarily symptomatic. So the type of people that are approaching us for testing are a little different than at the beginning when people were coming because they were sick. Next slide. And then this is something a little new, but I wanted to show you a little breakdown of the types of symptoms people are reporting. In our community, about 12% of the people that are testing positive have no symptoms at all or are reporting no symptoms. And then through the list, you can see fatigue, cough, fever, chills, shortness of breath, muscle aches, headaches. Those are probably the most common ones. And then down towards the bottom, even abdominal pain, diarrhea, nausea, and vomiting. So it's kind of, when you look through the list, it's like almost anything that could make you feel poorly is a possible COVID symptom. But for sure, we are seeing our share of asymptomatics, and this does match pretty well what we're seeing in the region, which includes Oakland and Macomb County as well. Next slide. And just to remind you, we have daily updates on our dashboard, so please go to www.schhealth.co and go to our dashboard, and we will update numbers every single day there for you as well. And then, of course, are we doing twice weekly reports now with the graphs? No. Once weekly still. So once weekly, and as or if the situation continues to change, we will adjust that and start reporting more frequently as well to you guys out in the social media world. So that's the media or the data information, and we'll get to some questions. And why don't we start with Trish, your first question that we had collected from last time that you have.
I have the question, is it safe to be transported by ambulance? And the answer to that unequivocally is yes, absolutely. If there's something I can share with you is that information that we obtained today were that the amount of at-home deaths have increased. The at-home deaths have increased by 62%, or out-of-hospital deaths. People that have passed away at home from cardiac arrest has increased by 43.3%.
So people aren't calling.
People aren't
an
calling, and I can't stress the importance of, if you're not feeling good, there is no reason that you can't call 911, and you should call 911. If you're hesitant, we can certainly come out, we can talk, we can assess, we can help, we can encourage, but the answer is not to just shelter in place when you're not feeling well. So call. Please call us.
And another piece of data I'd like to share, which is great opportunity, the Tri-Hospital EMS, of course, is our primary first responder service. And right from the beginning, they were going on calls, people that appeared to have COVID, respiratory. And you guys were very proactive in training and very aggressive PPE. I believe you have PPE for everything. And how many positive COVID cases have you guys experienced as an agency?
We have encountered 135 COVID positive patients.
And how many of your staff have gotten infected?
0.
So
0.
it is possible and reasonable to protect yourself, and you protect yourself with PPE. Okay, so I think that was the point I was trying to make, is, it's not over. Even living and exposing yourself directly to an individual with an infection, you can protect yourself with the proper kind of equipment, with washing hands, but certainly with the mask. You guys, of course, have the whole gear as well, but it does work. It works. And we're seeing the same thing in healthcare providers too. Very few of our healthcare providers have ended up sick because they're taking care of protecting themselves. Okay, do you have a question?
Question for you, Dr. Mercatante. Why isn't the map of cases posted every day like it used to be?
Oh, the map. You guys love our map, and we stopped posting actually daily reports a couple weeks ago. But the map in particular you liked. And what we have hesitated with the map for 2 reasons. One is there are, again, in our community often very few cases, and sometimes these communities might have 1 case that can inexplicitly identify an individual with COVID. And we really take very seriously that personal protection and confidentiality. So if there's ways of identifying people without giving names and addresses, that's one of them. So we're very hesitant to do that. So the other reason, and I think it's even a more important reason, is that people like to look at maps because they think, okay, I live here, and therefore, because there's not a lot of new cases here, I'm okay. And that is not what the map means. The map is where people live. It is not where they've traveled, and it is not where they've been infected. So the map does not give you any should not give you any sense of security whether you can or can't do something outside of your home. The virus is everywhere. Assume it's everywhere. And if you follow the right protocols, it doesn't really matter where you live or how dense that population is. Okay. But let me go. If the need arises and it makes you guys feel a lot better, we will consider doing maps more. But I would be more comfortable with that if we started seeing only if we start seeing a lot more cases. Okay, so that we're not outing an individual here and there. So more to come.
A question for Trish. What has EMS seen in relation to COVID calls on your runs?
I would say, going back to the first question, is it safe to be transported? We've seen sicker patients. Everybody that we come in contact with, I shouldn't say everybody, but the majority of the folks that we come in contact with just tend to be sicker. Those that have the COVID symptoms, obviously respiratory is an issue for them, the feeling short of breath. The fatigue is a huge one. They're just very tired, just can't seem to recoup no matter how much they sleep. And then, of course, a fever. For us early on was a big indication that they could be there. But certainly the flu-like symptoms, the muscle aches, probably about 3 or 4 weeks ago we really started asking a little bit more about the taste, if they've lost their taste. That seemed to be a very common sign. And again, just once we get to the houses, patients tend to be more critical than they have been in the past.
Which might suggest they're waiting longer.
They absolutely are.
Yeah. So if you're sick, contact your healthcare provider and call 911. It's worth it.
Dr. Mercatante, this
Yes, ma'am.
question is from a viewer that has a question about reporting purposes. So for example, an employee tests positive, is sent home, and needs to be retested as negative before they can return. So, employee goes back to retest at 2 weeks and they are still positive.
Right, that can happen.
They wait another 2 weeks and now they're negative. So what's the 2 positive tests in one person? Is that taken into account in the reporting?
So, and I'll be very clear, I do understand that certain employers are requiring a negative test return to work. That is not our requirement. From a public health perspective, we know that the virus is generally not transmitted after about day 10 of an infection. Certainly after the first few days, the viral load goes way down. The virus particles can linger for a long time in your nasal and respiratory passages. And what we believe is probably happening with people who are testing positive over and over again is that they're just not shedding all that virus. It does not necessarily mean they are still infectious. We don't know, of course, for sure. And so if you get a positive test, you're going to be considered infectious and you're going to be off again. So one of the ways you can do that is wait the 10 days at least from the onset of your symptoms. Make sure you haven't had a fever for the last 3 days, and make sure you're feeling better. And if you meet those criteria, we call them clinical criteria, you are generally not going to be contagious. You go back to work, you wear your mask, you keep your social distancing, and we feel that you're safe. If you do choose to get retested and you're positive, then you're positive, and you're going to be off again for the duration, the 10 days until you're retested. So we don't know exactly why that happens to certain people, but it does. And we'll know more as we learn more about the virus, but it is unfortunately a reality for some people. We also have to be careful because if you have an immune-compromised system and have prolonged viral testing, that might suggest that you could still have replication. So we just have to assume that a positive test means an infection, and that's how you're going to have to roll with it.
Question for you, Trish. What screening is done by dispatchers when someone calls 911?
Besides the normal questions that they would ask, there's additional questions that are in place if they're having difficulty breathing, if they're having a fever, what was the other one? And any type of flu-like symptoms. Those are the 3 main ones that you'll see asked. The other thing that you'll see different is that when we arrive on scene, when we approach the house, we don't go directly up to the patient. We stay at the door, or we try to keep a distance because we're just wearing our surgical masks. We then ask those questions again. Some people get frustrated. They're like, I already asked all those questions, but it's important that we ask the questions as well. It's just a double check, making sure. Because if you answer yes to any of those, we're going to back out, and then we're going to go and we're going to put the N95 on, our gowns, our, everything, making sure that we're safe. And then as soon as we approach the patient, one of the things we try to do is obtain the temperature right away, just so we can get a baseline. Other than that, that's the only thing you should see different with a 911 call.
Okay. Question for you, Dr. Merck. I've seen people in stores that aren't wearing masks, and I get frustrated because I wear mine every time I go out. Is there someone I can report this to?
Thank you for that question, and it is frustrating. Wearing a mask is the right thing to do, and for all of you who are trying to do it, thank you very much. Masks are uncomfortable. I don't like wearing them either, but it does make a difference. And in this critical time where we're seeing this gradual increase, the way we're going to get through this and not have a problem again is everybody complying with social distance and masking. So you're at a place, the store or the whole facility does not meet your expectations. What we'd like you to do initially, if you can, is speak to the owner or the boss of the place. Sometimes they just need to know that their clients and their customers care about that. There should be signage. They should be requiring masks to go into a public business. If that fails, you give us a call. It's 987-5300. Or you can send us an email at covid19@stcounty.org. We will triage that complaint to the appropriate division, whether it's restaurants or businesses, and we will contact them and talk to them and go through a progressive process where they'll get a letter and potentially even an executive order to cease and desist if we feel it rises to the level of a public health risk. There are also sites on the MDHHS site. So if you go to michigan.gov/coronavirus and you go to either workplace safety for employees or violations of the executive order, you will find places there that you can report non-compliant businesses. So lots of opportunities, and thank you for caring, and appreciate that.
Just to finish up the one question about the employers, and if you have to return in the 2 testing, a viewer would like to know, does that skew the data when you're being tested multiple times? As far as reporting?
Number one, it doesn't happen that often. And the individual that's getting tested is the same case. Okay, so they don't get tested and get counted as multiple cases. Unless they've recovered completely, been removed from the rosters, and then somehow get tested again and get counted again as a reinfection. These are very uncommon situations. And our nurses, as I've mentioned before, our communicable disease nurses contact each one of these positive cases, goes through the circumstances and the situation, and puts that into the system accordingly. So we do go to great lengths not to count people multiple times in a situation with multiple tests.
Question for Trish. You're at 0% for your employees that are infected. So what are the steps that you're taking to prevent? So
obviously, first and foremost is the PPEs that we have for the employees. Every ambulance has plenty of PPE packs in them, so they can properly put on an N95, have their goggles, their glasses and or goggles, gloves, and a gown. But more importantly is what we do after the call, which is taking the time to make sure that we disinfect everything. So we have a cleaner that we use, and it's a spray. So as soon as we take the patient in, we come back out, we spray the entire truck down, the stretcher down, the bench seat down, the captain's seat chair down with what we call BNC 15. Let it sit for 3 minutes, and that kills everything. We also were lucky enough to have ServPro come out, and they disinfected all of our ambulances for us at no cost, something that they were providing for the first responders. And then we were also lucky enough again to receive a grant from the Community Foundation and United Way for the purchase of 5 UV lights. And what that will allow us to do is you set the light up in the back of the truck, you turn it on, it sets on for a certain amount of time, and it hits every surface, even like the little crevices that maybe you might miss here and there, and it will do those. We haven't taken receipt of those yet, because everything dealing with personal protection is on back order, and we've been waiting, but we're excited to get those. But in the meantime, our crews have really just been stepping up and making sure that they're cleaning after, even if the patient wasn't positive for symptoms.
I think it's the conscientiousness,
it is.
To be honest with you. It's paying attention to your environment and to yourself. And I think if you do that, your behavior can really drive your risk. So it goes back to...
and when you see the people that you're transporting that do have the COVID symptoms, and you see how sick they are, nobody wants that, right? So you take that extra step. That's their house for the next 12 or 24 hours, and so they have to be in it longer than the patients do, and they certainly don't want to get sick. So that helps as well, them just taking the extra steps.
And I appreciate you speaking to the people that you see that are really sick, because as we know, the vast majority of people who get COVID don't get seriously ill. The ones that do, it can be a nightmare. And I just got wind of some college-age COVID parties that people are having, getting together when they have a positive case so they can all get infected. And I just cringe, because you can get seriously ill regardless of your age. Just because you're young doesn't mean you're exempt from getting sick. And the illness from this is, when you get sick, it's quite profound. It's very prolonged. People feel crummy for a really long time. This is not like I get sick for a couple days and gone. I mean, if you are unfortunate enough to get really ill from it. So please take it seriously. It's a bad virus. Go ahead.
Another question. With the beaches open, is it safe to be in the water? Safe to be on the beaches? What's the likelihood of contracting COVID in a public space like that?
Okay. So first of all, let's get rid of the word safe. I'm not into the word safe because it's not accurate. Nobody's safe right now from getting COVID. unless you live in a sterile environment where no one comes in or out, period. Okay, the reality is there's riskier, and more risk and less risk. Okay, so your outside in general is less risky. When you have a lot of air circulation, the virus spreads from your respiratory secretions to the other person. So if you're outside, there's a lot of air current, much less likely that you will receive the viral load that overwhelms your own immune system and gets you sick. But if you're right on top of somebody, you're on the beach and you're like on the same beach blanket and you're talking to each other and that person's infected, you can still get infected, okay? So that's the issue, is the people on the beach and the number of people that are on the beach. Swimming, I don't think there's any concerns about water transmitting the virus. It might, though, get on your beach equipment, and then you could inadvertently. But the real issue is the people on the beach. And then your risk relates to the amount of community transmission we have. So right now, we still have a low amount of community transmission. So, I don't know what that would mean. 1 in, 1,000? How many? 1 in 500, okay? So your chance maybe 1 in 500 of coming in touch with someone. So think about that. On a beach, there might be 1,000 people, might be a couple people there that have COVID. If the transmission rate goes higher in our community and there's more people that have it, then your risk is going to be higher because there's just going to be more people walking around with it. So that changes over time. But do remember, again, it's really the person-to-person connection there that puts you at risk. Outside, less risky than inside, and then crowded versus non-crowded. Okay.
Question for Trish. What can the ambulance staff do to help someone struggling with their breathing?
We can still do just about anything. The only thing that we have really changed is the aerosolized breathing treatments. And so for those that have asthma, we certainly try to stray away from giving them an updraft, which then would aerosolize out, back out as they're breathing. So that is really the only thing that we have changed that we're not doing in the back of the ambulance. We can still administer oxygen. We can still assist in ventilations if that's what's needed. We have inline filter that we use on the BVM, which is a bag valve mask that we use. We can still intubate patients. So as far as treating somebody with difficulty breathing, we can still take care of it. This goes back to it's now more important to not wait until you get so severe.
You don't want to be intubated.
No.
They do a great job, though, by the way, but you don't want it. If you think masks are uncomfortable, try being on a ventilator. They're really uncomfortable. Another question.
This is the 5-minute
Okay.
before we're done.
Okay.
We'll take another question. This is in regards to air conditioning. Is that a risk when you're in a restaurant with air conditioning?
Yeah, it's funny. I was just reading an article about that. And it's, again, there's so many articles that come out and maybe show one thing or another. But there was an article that showed that some people got more infected if they were in the direct range of the air current from the air conditioner. And again, it goes back to this virus circulating in the air, okay? And so if you have an air current, so if I'm sitting here and the air is blowing that way and the next person's here, that person in that range of that air current could have a greater risk. It's not the air conditioning in general that's the problem. It's the fact that people inside the facility might be expressing that virus, and the air conditioner might be in a way that's pushing it in one direction or the other. So air circulation and heating and cooling and venting is all very important. But if you're going to a facility, I wouldn't worry if you do not want to go somewhere that's not air conditioned right now. It's pretty hot. Wear your mask. Just wear your mask. And if you're sick, don't go. I think those are the more practical explanations I can give you right now. And we'll know more as we go.
Okay. Getting close to time, do you have any final comments, suggestions, or anything you would like to offer the audience?
I'm going to go back with what Dr. Merck just finished saying is the masks cannot be discounted. When you're anywhere but at home or in your vehicle, you really need to have the mask on. And if it's not, if you don't think that it's protecting you, understand that it's protecting everybody else.
And we are learning more
you.
and more that the protection is very significant and very real. We are, of course, investigating every case that comes up positive. It's called contact tracing and case investigation. And we're running into some difficulties where people don't want to answer their phones and talk to us and call us back. This is a critical component of trying to keep a lid on this thing. If you get a call from us, please pick up. We protect your personal information religiously. I can tell you, we will not share it with anyone. And one of the questions is, would the health department tell people who exposed the name of the person who was infected? The answer is no. We would not tell you. If you had an exposure, we would tell you you've been exposed, but we would not give you any information that would indicate who that would be, okay? So we do work very hard to protect your personal information, and we won't be asking you for a social security number. We won't be asking you for any insurance information. If you're not sure it's us, hang us and call us back, okay, and ask for us in case you're not sure if it's a scam. But it's really important that you answer our questions. It's the only way we're going to control this outbreak. That's it. Thank you for joining us, and meet us next week again on Thursday at 3:30 for Facebook Live. We'll answer your questions to the best of our ability, and stay safe.